it 6:03, 6:02? Yeah, let's get started. This is mainly for you guys, and if there's any fellows out there or any even early attending people that are like, we do. It's made to be very conversational. So, feel free to just interject. It's kind of like my last thing where it's just a bunch of PowerPoint pictures and we can just kind of talk it through, and it's not meant to be serious at all. So I changed the title this time around because last time I had it written as "So I'm a fellow now." So this is for you guys. You guys are attending now in about a month or so. So this is essentially going to be a talk of like what you should be doing now, and then how to kind of get the ball rolling when you get into practice. So this is you guys now. You're excited. You've made it. Finishing training. You're stoked. You're celebrating. Life is great. For most of you, you've put in about 6 years or so, and then for some of you, you've put about in the neurosurgery world a little bit more. R.I.P. Nikita. I don't know if he's on this, but you're excited to be done, but you got to remember, hold up here, and take a minute because there's a whole month left, right? And so these are Bob and Greg laughing. So I kind of tell people like, ultimately you kind of get remembered as how you leave, right? And so if you got this month left, it's easy to check out. It's easy to like just be on your way and just be doing all your stuff, credentialing for your new practice. But people are going to remember how you leave here. So if you leave here kind of the way you came in, and stay on top of things, don't just check out. That'll be really important for you. So what should you be doing between now and August 1st? So that's just in the next month or so. Probably the biggest thing, and things that'll make your attendings happy is finish your research papers, right? Because you don't want to be that person who's done with school, but you still got to turn in your papers and all that stuff, right? And you don't want to graduate and still have another class to do, right? So just get it done now, because you think like, oh, I'm going to have more time. I'm not, you are actually going to have more time, but you're not going to want to do it. You're going to just kind of forget about it. There's going to be nobody on your butt kind of checking in on you like they do every Tuesday morning here. So it's easier to just put the time in now, check it off, be done, and move forward. You've had a lot of papers and studies and chapters and everything, abstracts and everything. So just update your resume now. You're probably having to do it for credentialing anyways, but you will be surprised, and you are going to get more busy, and time is just going to change, and you're going to have kids, and you're going to move and all this stuff. So just kind of bang it all out now. It'll really change your life to just be done. Now when you have all your attendings and everything, collect the notes, templates, op reports, booking sheets. I know you guys have been asking me for a year for my stuff, so I'll send it to you. But if you see something that you like, if Bob or Greg or Bruff or Ali are doing something that you really kind of like, and you think that this is really going to work for you, then get it. For me, I think I've shown you guys this before. Like, I have this document where I can essentially just kind of click my diagnosis, my CBTs. Everything's just all there for me. I don't have to think about it. Some of the guys here just have it all memorized, and you'll get there. But when you show up into practice, you haven't really done billing and all that stuff. Just make it easy for yourself. Just realize, okay, just click this, and mail it off to your scheduler. When I first started, I was doing it on paper, and I'd hand it to her. And then we would either lose it, or she, goes between two offices and she'd forget it, so she couldn't work on it. So if you email it to your nurse, your scheduler, your whole team, everybody has it. And you can always look back and be like, oh, well, what did I schedule this person for? I have some like sayings I stole from Dan Rue of like, early asymptomatic stenosis, and I got little dot phrases and just pop them into my notes. I have one on radiculopathy that says, 3 months of treatment, how much people get better, what to do. So Now is the time to kind of prepare your practice in advance, right? Get all your pre and post op paperwork created, right? How are you going to do things? For when I was showing up about a month and a half in advance, Bob sent me all of his uh, pre op post op paperwork, and I essentially went through it and kind of changed what I didn't like or changed, what I thought would do differently. And that's still the paperwork that we use now. So like what it tells people like when to take the dressing off, how much medication, what medications to take, what kind of foods, what's normal, when to call in the office and say like, hey, look, something's wrong, right? So, um, as a little secret time, I used this slide last time, is to think about how are you going to talk about back pain, right? How are you going to talk about neck pain? How do you explain SI joint pain to people, right? Piriformis syndrome. How do you talk them off the cliff that the chiropractor sent them down, right? So your carpal tunnel, right? You have to kind of think about carpal cubital tunnel, and you've heard different spiels from all of us of like how to tell people, hey, it's not your spine, right? And you got to kind of think about that, right? People getting dizzy, right? You have to try to think about, well, why are they getting dizzy, and how it's not coming from their cervical spine, right? And tell people, how some of this is just due to weight, right? And then how do we lose weight? And that's a big thing. So this one hits home for me is that hey, you have to explain to people that laser spine surgery is not real, or at least don't explain it or don't acknowledge it. I had a 1-star review because a guy got mad that I told him laser spine surgery was not real. So it's this is AI generated, so it's a marketing tool for minimally invasive spine surgery. It turns out, so, kind of funny. Took my ratings down. If you only have 2 ratings, while 1 star will really hit you hard. So. So what should you be doing in the OR, right? So now you got, whatever, 3 weeks left. So what do you do here? So again, I used this last time, is you do know what you're missing, right? So what have you not seen? What is there going on that you're like, I've never done any of this, or I did one, right? I did one, you guys do more PSOs, but like I've done one PSO, or I've done one far lateral discectomy. I've done one cervical foraminotomy with a tube. And if you haven't done enough, see if you can find it on the schedule. And usually everything's being done at least once here every month. And so I think Tim, like that was the first like C2 you've done, right? So like, look for this stuff. And you can start to kind of cherry pick. Obviously you have your rotations, but everyone here is definitely flexible, and you may have some time off, or you may have an afternoon where you hop in with somebody else, um, and really kind of learn something that you hadn't seen. Um, this is kind of I would tell you, you're all ready to go, and you're all ready to operate, and you want to maybe be left alone and be like, I want to see if I can do this for anatomy by myself. But I would urge you to go on the other side of the microscope. Go be an assistant, right? And I think any of us would happily oblige. And if you were like, hey, look, I kind of want to, I've done a lot of ACDFs. I would like to just assist you on this ACDF and have the attending not talk. And you should be able to put the retractors where they need to be and get us to where we need to be. Because in a month from now, you are going to be operating with a PA, med student, a fellow, so, somebody that, yeah, scrub tech that maybe has never done this. And you have also never placed the retractors. And all of a sudden you're like, holy crap, what do I do? Right? Where does this go? How do I get this to sit right? So this is the time for you to essentially become the assistant, and it's kind of like doing total hips, right? And knowing where to put the retract, I don't even know what they're called anymore, the Charlie, and right. So you gotta if you don't know where to put the retractors, how do you do the surgery, right? So that's really a big thing, and you'll realize in fellowship we used to do the ACDF with a scrub tech, and I don't know if they knew what they were doing or they just pretended not to, but you have to learn how to place those retractors. So, and oftentimes we're so quick to adjust it and make it like perfect, right? So, most of you probably don't know who John Stockton is, but he's like, the best assist guy ever. And so that should be you, right? You should be able to hold that, appendiceal and pull it towards you. So, really focus on that. I know it's hard to say like, hey, you guys are at the end of fellowship, you guys are learning how to operate. You have all the time in the world to do this by yourself later. But this is your time to let somebody else do that and you do the assistance. So what are you going to do, right? Start to think about like, are you going to be the segmental person? Are you going to be doing real plates? Are you going to be doing crazy hybrids, or are you going to be doing the disc replacement only, right? Are you kind of like, where is your practice going to take you? And obviously, boards are around the corner for you guys. Now we have a separate top, and we're going to talk about how to pass boards, which hopefully I pass. But you kind of start thinking about like, what are you going to do, right? What are you going to use, right? Because all of a sudden, and probably already people are coming towards you, right? Of all these different companies. And everyone wants to take you to dinner and buy you drinks and show you all this good things that they have. But like, what are you used to? And what's in the area? What reps are you kind of get along with, right? And so a lot of this stuff is similar, right? So it's ultimately like, who are you most comfortable with, right? So I left this slide in here from last time because I thought it was funny. So you have the 7 attendings here, and so take what you can from each one of us and incorporate it into who you are. Right? So from August 1st to September-ish or October, whenever you're going to start, but start before November because that's how you get your boards, right? So I think you all are. So this should be you. Should be traveling, you should be moving, should be partying, celebrating because and get rid of your phone for a little while. And this should ultimately be you. Right? So for a month or two, this is you, and you should enjoy life. You should come into your job essentially with no regrets, because guess what? Now you get back to work, right? And you went from being the top dog here, and it's essentially you and the attending, and all of a sudden it's going to be you right there at the bottom, so, right? And you're going to have your partners, and the OR doesn't know who the hell you are, and nobody cares, and the hospitalists don't care, and so just get ready, right? And oftentimes you'll feel like an imposter, right? You just don't want to know who you are in your own skin, and you'll wonder how you made it this far. So how do you spend the first time period of your life as an attending? So the biggest thing is just go and sit in your office and think about your workflow, right? So when I showed up, so with in fellowship, our attendings would carry a laptop around and show the images on a laptop. And I was like, I'm going to do that. I bought a big screen laptop, and I was like, I'm going to walk around. And the first day of clinic, where I had like 4 patients, I realized that my Epic would sign out on my computer very often, and it was actually impossible to look at images on the laptop. And so I was like, okay, well, why don't I just have the screen on in the room, right? So it was a big shift for me, and these guys made fun of me for a while because I had like 9 screens in my room. I had a laptop and 2 screens, and everything was set up, but you just got that was a big workflow change for me that I had to adjust to. How are you going to use your MA? How are you going to do the orders? Who's going to do the orders? Who's taking your phone calls for you in the middle of the night, right? Is it you? Is there a service? So kind of things that you just need to figure out because you don't want to get busy and all of a sudden you're like, oh, I never thought about this, right? Scrubbing is your partner. I spent countless times with Bob and Greg and Bruffy and learning their ways and also just getting reps, right? So if I finished clinic early, I'd head over and just watch a decompression or watch just kind of pop in and just see what's going on there. Talk to the OR. Just go meet people. Go talk to the OR about your preferences, your cards, things that you can do. How do what tables there are, what microscopes there are, like what's the workflow. You really want to introduce yourself to people, right? You want them to know who you are. You want them to you want to be nice. Obviously, you want to be approachable. You want to be humble, right? You want to be that person that everyone kind of wants to be around there. Because the only way that you're going to get stuff that you want is if they like you, right? So make new friends there, and just it's kind of like being back in kindergarten, right? Where you feel like everyone's just busy and moving around, which they are, but you got to kind of join the team. So now that you've done all that, everything's we're good, we're ready, right? We're gonna rumble, right? Ric Flair. So and you show up to clinic, and this is your clinic log, right? And then here you are, right? You have 6 years and you've prepared and you got the best pedigree in the world and life's awesome and you're ready to operate and you think you're going to pop into a 35-person clinic and there's nobody out, right? So now you're desperate, right? So how do you get busy, right? What are the ways? And so this is just like a personal approach. So, obviously I'm also benefit from the fact that Scripps just has like all these people that just need to be seen, and um, some of them don't need to, but they need to be seen. Um, and so, everybody always talks about these three things, right? So that being available, affable, and able. And in reality, it's the availability part, and you guys have heard this 1,000 times, right? It's the availability part that's really important, right? So um, if you are always available and people can count on you, and you say yes to a bunch of stuff, and your phone's on, and the ED can reach you, or your partners can reach you, like you're just going to get this. People are just going to think, okay, this guy's here to work, and he wants to be here, and he's helpful, and he's awesome, and there's going to be times where you have to say no, or you're not available, right? And you have to also kind of you have to try to manage that, but it's definitely easier early on. You got nothing else to do, you might as well be available, right? Oh, and obviously be nice, and hopefully your ability is there already. So, just be a yes man. And so these are kind of some things that I've done. Early on, I was giving old people home talks. A lot of the retirement communities that we have out here, and I had like a couple talks on like lumbar and cervical degeneration and just stenosis, and I probably got like 10 or 15 consults out of it, and mostly people over 90 that never had surgery. But like, it's getting your name out there, right? It's going to talk, it's going to meet people, and it just gives you an opportunity to expand your connections, right? And in all your training in your life, the ED has been the worst thing, right? Your ED is hell, right? People there don't like you. They're just trying to ruin your life. And it's just consult in the middle of the night. You've got bad experiences. But now all of a sudden, the ED is your friend, right? Now, these are the people that are ultimately the gatekeepers to your practice. And so go down there, introduce yourself, meet with the head of the ED, take some cookies, take some coffee. Hey, I'm the new guy here. I'm available. Here's my cell phone number. Please feel free to always call me, even if I'm not on call. And you can't reach who is on call. Like, give me, reach out to me, and I'm happy to help. Right. So that's going to be a big thing to help you. And I did a flyer. I emailed a flyer to all the Encinitas hospitalists about who I am, my practice, and kind of what I want to do and what I look for. So you can do that as well. Visit some PT offices, right? Because these PT places, they just see names, but they never see the person. So you guys know that I send people to PT in a bunch of places, but I kind of have a couple places picked, right? Because I've ultimately filled their clinics up, and they're filling our clinics back up because they see our name very often, right? And it's kind of the same thing with pain management, right? You're gonna have partners that are pain management, but some of them already have a surgeon that they already sent you, right? So maybe you meet the new young guy as well, and you guys kind of can bounce ideas off each other, or try to figure out somebody that you get along with, right? And so for me and Encinitas, everybody, the first stop after having back issues is a chiropractor. So go and meet one or two, because people are going to be like, well, who do you trust? And you can say, well, I don't really recommend it, but if you have to go see a chiropractor, this might be your person, right? So and some people swear by their chiropractors. So when I first started, I sent thank you emails to every referring provider. So I had a little template where I just changed the name, and then I put a little quick. Obviously you have to do it through a protected thing, but I put a little quick blurb about the patient I saw, and what my plans were, and how we're going to get them there. And thank you so much, and I'm happy to take care of your patient anytime. So, and that helps. So then, how desperate are you? Right. So this is kind of a new thing now that I started to have some chest pain from this job. I went and saw my primary, and all of a sudden now he sends me all the referrals. So they were like, there's nobody showing up to your clinic. Make up some chest pain. Then maybe you can get a cardiologist too, and you can start to see. My wife actually sees a different provider, and now I get all those referrals as well. So, and kind of say this is a numbers game. Obviously, you want the quality of the consults and the work, but in reality, when you're starting out, you just want people to hear your name over and over and over again, right? So um, just be open to that. I mean, you guys have seen my clinics, and they're full because I'll see any and everybody, right? And ultimately, when that person leaves, they met me, they can tell somebody else and tell somebody else and tell somebody else in the future, and that disconnect kind of will essentially you're investing early on to build your practice, right? So early on, right, take it easy, relax for surgeries, right? Only easy cases first. Obviously, a little hard if you're taking call, right? But you want to show up and do a good job, and you want the OR to think you're good, right? Because if you show up to do a microdisc and it takes you 6 hours, that's your first case. That might be what sticks with you, right? Oh man, you don't want to go, with Dr. Jordan. He took 6 hours on the microdisc, right?
Dang.
Right. So you got to think about that, right? So and I tell you to overbook the time that you need, right? If you have a single low ACDF and you think it's going to take 2 hours, book it for 4. And the OR is going to think you're crazy at first, but then you finish early and they're like, oh man, he's pretty fast, right? Just it's a little bit of a gamesmanship, but like this, it's real. Call, text, email your mentors, and I've called and intra Bob and Ray, everybody here as well as my mentor back home. So don't feel like you're stuck, right? So now you're busy, life's good, you're moving, right? You're whatever 6 months into practice, now is boards time, but you got to take care of yourself, right? You need to lift, or exercise, or whatever kind of ways that you like to do, and meditate. Think about kind of the inside as well as not just like what you're doing. And yeah, I'll tell you a bunch of these things. I'm still trying to figure this part out myself. But take some vacations, which are really going to kind of help reset you. And it's hard. From myself that hasn't taken a vacation since I started, really. It's hard to get away because you're like, well, I earn an income now. If I leave, I'm going to lose X amount of money or this and that's hard to get away from. But like ultimately, you need to do it. So why do you need to do it? This job is stressful, right? Nobody, I don't feel like, or maybe I didn't listen in the whole training and everything, but nobody tells you how stressful this job is. You have always had an intermediary between you and the patients, right? They've never been your patients. You're on Mondays to service, and you have patients, and then all of a sudden you move on, and now they're Gotham's problem, right? Um, Starting August 1st, they're your problem now. Right? So if something goes wrong, or if patients aren't happy, or you've never received those phone calls about people, 2 weeks out, and they're like, my leg still hurts, right? And that will cause you to have a lot of stress, and that's okay. That means you care, but you have to care a lot, but also not let it affect you a lot, and that's very hard to do. And that's honestly um, it changes throughout your practice. And so you're gonna find yourself sitting next to your phone, thinking about your patients. You're gonna dream and have nightmares about your patients, right? For us, it's 100%. You're gonna have nightmares about your patients. If I wake up to use the restroom in the middle of the night, I get back into bed and I start thinking about my patients. Like they just randomly creep into my head. So just be prepared and have a support system, your family, your mentors, your friends. That's why you need to really take care of yourself. And at the end of the day, if you need somebody to talk to, right? So this was me in Mundus's office a couple of weeks or months ago, and like just sit down and talk to somebody. And you guys have come to Wednesday clinic in Encinitas where Bruffy's there, and we just start showing each other X-rays. And then, for me, that's kind of like I'm like doing confession, right? So, I'm going to Bruffy and he's absolving me of my sins. Like sometimes you just need to be told you've been a good boy or a bad boy, right? And that's for me. That's kind of what I do when I start showing X-rays to Bob or Bruff or Mundus, and I just need to be told, oh well, yeah, it doesn't look great, but it'll be all right, or hey, good job, that looks great, right? Which you don't get that very often. So, lastly, you can't do this by yourself, right? You have a team, you have a nurse, you have a scheduler, you have an MA, you have partners, and you really need to treat your staff the way that you want to be treated. And you want your staff who is typically either salaried or hourly to buy into your practice, right? So how do you get them to work as hard as you are for something that is yours, right? And ultimately it's theirs as well. But buy lunch, have meetings quarterly or every 6 months or so for your team. Take them out to dinner, meet their families, or really get involved. For when I first started, I did payday pizza. So every other Friday, I'd buy pizza. And that was kind of like how we sat around and talked to each other. But if you have fellows or trainees, I buy you guys lunch. You guys are doing a lot of work for free. So show up and have your team, invest in your team, because the return on that investment is like exponential, right? So, good luck. So there you go. It's a road, and it's different for everybody, and you're either going to be happy, or you're going to be stressed, or you're going to be sad, or it's going to be great. But it's all just part of the journey to get to the end. So questions. It's real.
Did you just take like every op note that you could before you left too, or?
I took them all, and I revised them a little bit and made it so it was easy to adjust. And I've changed them throughout the process, but having like some sort of baseline, like you just wanted to say certain things, and having some sort of baseline. I look at their stuff too, and yeah, I click on everybody's notes and everything just to make sure that mine are kind of.
Gotcha.
My console template, I think I stole from Mondays. I just liked the way it looked. I just changed my name. So that's kind of what I did in my first week or two.